So I want to go over yanking someone's skull, pulling it. Why strap something around someone's chin and yank? Or why just ring their bell by just yanking and pulling at the skull base? Now, I'm not saying that that technique or that procedure hasn't helped you or it hasn't helped someone you know. And I'm not here to tell you that it's going to hurt you. What I'm going to discuss is why at this point we choose not to do this in our office. One, our neck is not supposed to go in the direction of ET's neck. Two, there's no ligaments in the spine that are supposed to be stretched this way. This is the upper cervical spine, C1 and C2. The skull sits right here. These alar ligaments, apical ligaments are not to go this way. In fact, their job is to make sure that it doesn't. The amount of force that it takes to rupture these, they've showed could be about 60 pounds, 80 pounds, which means when you yank with enough force to pull a grown person, they obviously weigh more than 80 pounds, the likelihood can be high to disrupt this. Now, if you do choose to get this done because you want to, you think it's going to help you, or you want to be on a YouTube channel or something to hear your neck and your skull pop off your spine, I would certainly make sure you're analyzed correctly. A digital motion x-ray should be good to make sure that you don't have upper cervical instability, an upright MRI so that you don't have Chiari, and to make sure you don't have a connective tissue disorder like EDS or Ehlers-Danlos syndrome. Why we're so passionate about this is that at Katz Chiropractic, we want what's best for our patients. I've never seen a study discussing this in any scientific literature about why it can be helpful, but what I have seen are studies to suggest how movements like that may and can disrupt the upper cervical ligaments. We've also published one of the largest cervical biomechanical papers that injured patients with symptoms could have upper cervical issues. So if it's not ruled out, you can't rule it in. Or you kind of have to rule it in to some degree. You have to figure out what is wrong. The mechanics of the spine are not to lift your head. Like you wouldn't put a towel around your neck that's hung, or a rope and jump off the bed to let it pop off. That can cause injuries. So again, I'm not here to tell you not to get it. It's your body, you're gonna do what's right. I'm letting you know that if you come to Katz Chiropractic and Rehabilitation Clinic, we're not gonna do that. We are gonna assess your spine, look at what the mechanics are, and do adjustments and treatment to go with the force of the ligaments as opposed to against them. If you have any questions, give us a call at Katz Chiropractic and Rehabilitation Clinic. Thanks so much.